Gentleman from Texas, Mr. Doggett, is recognized for 5 minutes.
Thank you. How appropriate and important it is that we are focusing on health care and pre-existing conditions as the first formal hearing of this new and much improved Congress. In understanding where we go forward, it's important to understand the path that has led us to today. And that path is 8 years of Republican persistence in trying to destroy the Affordable Care Act and its protection for pre-existing conditions. Trying again and again and again, dozens and dozens of times to repeal the Affordable Care Act and its protection for pre-existing conditions. And failing on those efforts, then moving to try to weaken and undermine the Affordable Care Act in any way that they possibly could. One thing that has been missing from that path is the replaced part of repeal and replace. Not once was any comprehensive alternative to the Affordable Care Act and its protection for pre-existing conditions ever presented for a vote in this committee or any other one. It's great to hear that they want to work with us, and I hope that they do, in moving to a better place and correcting some of the obvious deficiencies of the Affordable Care Act. But it would be even better had they advanced a comprehensive replacement, if they had one, for a vote and action over the course of the last 8 years. On Inauguration Day, not even getting to the inaugural dances, President Trump decided to join their effort to destroy the Affordable Care Act, and he issued an executive order on that day to tell all federal agencies to do everything they could to undermine the Affordable Care Act. And the most recent example of that is what is clearly collusion. It is collusion between an indicted Texas Attorney General who sought to destroy protection in the court with pre-existing condition, and the Trump administration, which instead of defending that protection for Affordable Care Act, decided they would just lay down and play dead. And had it not been for the important intervention of attorneys generals from states across the country to defend the Affordable Care Act, there would have been no contest over this total capitulation by the administration. Republicans can tell us that they believe in pre-existing conditions, but this is more than passing some sense of Congress resolution. It is a matter of structuring a way of accessing health care that does protect without exorbitant premiums those many Americans, almost half of Texans, who have pre-existing conditions. Perhaps the most troubling aspect, in fact, of pre-existing conditions, maybe the most overriding pre-existing in America today, is amnesia, the political amnesia of those who have forgotten what it was like before the Affordable Care Act and how it was that those who would get a diagnosis of a serious disease would also be getting an effective diagnosis of financial ruin if there was no protection for them before the Affordable Care Act. The Affordable Care Act is far from perfect. One of the areas that I hope our committee will focus on is how we get an answer on the question of prescription price gouging, the need for Medicare negotiation, the need for more competition to reduce those costs. But Ms. Brooks-Coley, I would ask you one question. Across my area, I've been to so many Relay for Life events where cancer survivors come out and people from the community come out to support the American Cancer Society. And one of the statistics that I remember from those gatherings is the indication that if you don't have insurance, and of course in a state like mine in Texas with an indicted attorney general who keeps fighting Medicaid expansion, we have more uninsured than just about any place in the country, probably just about any place in the industrialized world, that you have a 60% greater chance of dying with cancer if you lack insurance than if you have access such as through the Affordable Care Act. Is that still the case?
Thank you for the question, Congressman. That actually is a 2017 statistic from our Cancer Journal. And it's a really important statistic that we actually cite oftentimes when we're having conversations about why patients who have pre-existing conditions have access to coverage. American Cancer Society research has shown that access to coverage and your ability to have health insurance is a deciding factor if you have a serious illness like cancer. What your diagnosis stage would be as far as when your cancer is found, what your treatment outcomes will be, how quality those treatment options will be, as well as survival rates. And speaking to your direct question, survival rates are directly linked to an individual's ability to have access to affordable, quality, and comprehensive health care.
Thank you.
I thank the gentleman.